Hello, and welcome to the Brainiac podcast. I'm Melissa Biscardi, and I'm super excited today because I'm joined by my friend and colleague, Sara Pukal, and we have a short and sweet little episode planned for you. But before we dig in, I do want to give a little shout out to our sponsor, and our sponsor is Head Check Health. Head Check Health bridges the gap in concussion care through simple, powerful technology. You can join organizations like the Canadian Football League, Trek Factory Racing, the Canadian Junior Hockey League, and Volleyball Canada, who rely on Head Check Health to improve communication and optimize care. You can visit headcheckhealth.com for more information if you're interested. And of course, the Brainiac podcast is the podcast of the U of T chapter of the Concussion Legacy Foundation. So we're all partnering together to bring you this super fun episode. Now, Sara Pukal is a manual osteopath, wellness coach. She is an amazing yoga nidra instructor, and we have known each other for a number of years. We met in osteopathy school, and then we worked together downtown, and I was so sad, and so many people were so sad when she moved to Stratford, but she's doing well there. And we, like I said, we teach workshops together, and our fourth workshop on cranial therapy is coming up. So we thought this was a good time to come on here and chat. So before we dig in, I will let Sara say a few words expanding on her bio. So Sara, thank you so much for joining.
Thank you so much for having me, Melissa. That's awesome. Happy to be here. So I did my undergrad at University of Toronto, St. George campus in a Bachelor's of Science, focusing on ecology and evolutionary biology, global health, and a minor in Buddhist psychology. So a little bit all over the map. And then I found my way into manual osteopathy and did the 4-year program, and have now been practicing as a licensed manual osteopathic practitioner since 2018. Had my practice in Scarborough and Toronto, and have most recently in the last 6 months moved to Stratford, Ontario. So really enjoying that transition. While I was doing my osteopathy school in undergrad, I also had a big focus in mindfulness, teaching meditation to chronic pain patients, and just how to live your life in a more mindful manner to help really hone in on those little moments, especially when there's a lot of pain, and how to get through the day a little bit easier. With that being said, I also took a training in yoga nidra and continue to have my own meditation practice as I teach others as well.
Amazing. And so actually, thank you for highlighting that. You have a lot of education training in the mindfulness piece. And I forget who it was that you worked with.
Her name was Dr. Jackie Gardner-Nix.
Okay.
So she was a very cool lady. Actually, we worked together. She was part a U of T affiliate as well, and with St. Mike's. So she worked with her chronic pain patients at St. Mike's and basically weaned everyone off medication, or got it as low as possible, and then used mindfulness and meditation to teach them how to deal with the pain they were in, and to figure out where it came from, but also to accept it as it was, and to live their life and move on in the best way possible to improve their quality of life.
That's amazing. And also, I have a lot of patients who've taken, I'm not sure if it's related or grown from her work, but different mindfulness courses, usually 6 weeks long, I want to say. And those courses make a huge difference in exactly patients' ability to manage their recovery.
Yes, it does. It really does. Yeah, it started with John Kabat-Zinn, but Jackie created the chronic pain version of that program, which if anyone's had a few incidents, unfortunately, they kind of fall under that chronic pain category. And that's probably the course they would most resonate with, because it is a little bit more body friendly.
So that actually pivots nicely into cranial therapy and just non-pharmacological approaches in general, which we are learning more and more just how powerful they are. I read a systematic review and meta-analysis that showed cranial therapy to be extremely effective in chronic pain. And that is like the highest level of research. And we rarely see those studies showing a positive effect, like regardless what they're looking at. So to have them look at something like cranial therapy in chronic pain, that's super powerful. And there was just a study released that exercise is at least as effective, if not more, for mental health than medications. So we're really learning to tap into the power, the self-healing, self-regulating powers of the body, which I think is one of the things we love so much about osteopathy.
Yeah.
And so we are going to be talking all about cranial therapy on March 26th. And, cranial therapy is a manual therapy that any manual therapist can use with their patients, and it is super powerful. I think traditionally it's been thought of as like a quote unquote osteopathic approach or osteopathic technique, but now massage therapists, physiotherapists, kinesiologists, so many others are really learning to assess and treat the cranial tissues and provide a more holistic approach and really incredible results for patients. So if a clinician or a patient asked you, what is cranial therapy? How would you explain it?
I describe it as getting the bones of the head to move. So kind of explain to them, just as every other joint in their body has movement, the joints and the skull should also have movement. Movement is subtle, but it should be there. So cranial therapy is working on creating more movement through the cranial bones of the skull or the cranium. And also part of that movement includes having better flow. So making sure we have enough cerebrospinal fluid that can come into the brain and also leave the brain. So good drainage, good supply. So that's probably the best way to explain it. And most people are actually quite surprised to hear that the bones of the head move. But when you compare it to every other joint in the body, then it makes sense. Why wouldn't it move?
Yes, absolutely. And also it would have to move in order to transmit forces. And that is the thing with a concussion specifically. Forces are transmitted from the body to the head to the brain, or the neck to the head to the brain, or right to the head. And so absolutely there will be forces that affect those tissues, and which is why I think cranial therapy is so powerful for these patients. And there was one patient I remember. So of course, patients feel better after, right? It's so therapeutic in and of itself to have the treatment, but then also it is effective. But then I had a patient come in who had been hit really hard. Something fell on her, and she had a massive amount of swelling on her forehead. Like it looked essentially like a golf ball, just of collected fluid. And one treatment, she sat up and it was gone. Like it can be very quick, very powerful as we treat those tissues to open up drainage, essentially. Do you have any patients that kind of stand out in your mind?
That's
Even
really
not
cool.
necessarily concussion patients?
Yes. Yes, I do actually. I find the cranial therapy really effective just for anyone who's stressed. So anyone whose nervous system is heightened, they might tell you that they're always tight, or they're not flexible, or they're tired all the time. Those are the kind of patients where oftentimes, as a manual therapist, you go to move their body and they feel like 500 pounds. Like they're just immovable. They're so, so heavy, which is not, that's not their weight. That's not how the body should feel. And those types of people, I really focus on the cranial therapy approach, because that will really help bring down the sympathetic nervous system, heighten the parasympathetic nervous system, and just start to get that body moving, get that flow moving better. Because when your body's always in a constant state of stress, it always is thinking you're running for your life. So it never has time for the muscles to relax, for the contractions to unwind. It's always kind of just sending way too much energy to your muscles and not enough to the rest of your body.
Yeah, and even we know like healing takes place in the rest and digest phases, right? In the
Yeah,
parasympathetic. So regardless if it's concussion or something else, we need to support that parasympathetic nervous system. What else do you like to
definitely.
pair with your therapy, like to support that nervous system? Because I know, I see on Instagram, you make suggestions for people to just build traction on the treatment.
Definitely. So anything that is calming to the body, so a gentle walk, a gentle bike ride, having actually a bath is really calming and very soothing for the lymphatic system, especially if you can just be in the bath, which is a lot of hard for people to not bring their phone in the tub with them. So little things like that. And then regarding other healthcare practitioners I like to work with, depending the severity of the case when we're dealing with concussions, I find a vision therapist is really helpful. Always a naturopath. It just, as a manual osteopathic practitioner, I don't have the designation to provide nutrition advice. So we need someone on the nutrition side because, as we know, our gut is our everything. It's our brain, it's our health. So making sure that the gut is doing well. And physiotherapist as needed. Again, every case is a little bit different. And until the person is out of the acute phase, you also want to make sure you have a little bit less cooks in the kitchen. Yeah. What
Yes.
about you, Melissa? Anything
I would
else?
say similar. I do feel the same way about cooks in the kitchen, also because we don't want to overload the system with too many therapies. And also, we want to know what's working, what combination, what recipe is working for the patient. And that recipe might change over time, right? Just like you're saying.
Yeah, definitely.
Um, oh, I was going to say one more thing, but it escapes me. It'll come back.
Well, I think a good point about the recipe is that something people want is a treatment plan when it comes to treatment, but there's no treatment plan because every time you come into the treatment room, you should have a different body, a different presentation. Perhaps the treatment process will be different. It should be different every time. So that's also an interesting concept that I find sometimes hard to comprehend in other realms of healthcare, that there isn't a kind of fixed plan because that plan is going to change based on the patient changing and improving and recovering.
Oh, I actually absolutely love that because it is true. We've come from a very Western model of protocol based. This is your 6-week plan. But actually, the body's dynamic unit of healing, right? And there is an ebb and flow. And you said something powerful there, I think, and treatment process, right? We have to respond to the body and then adapt the plan. Some people move faster along the pathway, depending on how the recipe's working, essentially.
Yeah.
And, some people need a little bit more time. So I think language is so powerful. So I really love that.
Yeah, that's awesome. And this is stuff too that we can talk forever about, but it's stuff we like to go through in our workshop together. Just designating that time to really go over this stuff, making sure that all the questions are answered. So that way everyone can leave really understanding more about concussions, cranial therapy. Again, doesn't have to be used on concussions, but we do want to make sure that everyone's informed about specific concussion care because that's something that not a lot of people know about. And I find I'm still treating a lot in clinic are people that might have had a concussion 1 or 2 years ago, but they still have concussion symptoms, which is very strange. And you wonder how come this has never been treated or looked at properly yet.
Absolutely. And now we know so much more. We're still learning, but unfortunately, a lot of people are still getting misinformation early on that there's nothing they can do or they should wait and see or stay in a dark room. So we definitely want to sort of debunk those myths. And I know when it comes to cranial therapy, there are many different people you can learn from, but I think where we've done a good job is we've curated knowledge on the anatomy, physiology specific to concussion as well, and selected assessment and treatment approaches that really serve as a really good foundation, and then even more for practitioners, sort of no matter where they're starting out, to be able to build some expertise to really level up the care. And then that's just going to benefit more and more patients. So the other side is, if this is being listened to by someone with a concussion, to seek out practitioners who can address those tissues of the head, which literally are housing your brain, and just work as a team with the rest of your treatment care team.
Definitely. Yeah. That's a good point, Melissa, that concussion care, treatment and care of concussion, there's many aspects that have to work together. One of them is the hands-on, and then there's many other components to that as well. But hands-on is key, as you gave that example earlier. You completely were able to drain a contusion that might have sat there for who knows how long if you hadn't gotten in there as quick as you did.
Absolutely. Thanks for the high five. The
No
virtual
problem.
high five. Okay, so I feel like we can maybe start wrapping this up, but what I would like to know before we do that is, I feel like you are a natural, I don't even think teacher is the right word, but yes, you are a natural teacher, sharer of knowledge. And I think together we are a good team. I think you helped to bring that out in me. But what do you love about teaching and sharing knowledge? Because it definitely comes out. But what's your favorite part when teaching a workshop or sharing with a patient?
Thank you, Melissa. That's very sweet. I think the educational component, just being able to share what you've learned and knowing whatever you share with someone else, they are going to get so much more out of it, because you're going to kind of open or water that seed that will start to blossom as they go around and learn more from others or learn more from their own experience, whatever that is. So I think it's just really kind of watering those seeds of education and intuition, and also just promoting confidence in people. We all have healing, intuitive capacities, and we need those seeds to be watered for us to actually understand those and be aware of them. So I think just helping people shine is what makes me happy.
I love it. Well, I can't wait to do that with you on March 26th. So if anyone is interested, well, please follow both of us on Instagram. That's where we share all our passion and knowledge. Sara is, and we'll put this in the show notes, but Sara is SMT Osteopath on Instagram. And that's actually her website also, smosteopath.com, and her clinical practice is in Stratford. So definitely, if you're out that way, make an appointment, go see her in clinic, and you won't regret that. And I forgot to mention, Sara has a podcast she does with a number of colleagues, and it's called the Osteocast. And that's something else you will definitely want to check out. And then myself, I'm concussionrehab.ca on Instagram. Would love to have you give me a follow. So lots of links for you to follow, lots of knowledge and passion that we're sharing. Hopefully you enjoyed this little podcast. And if you're a clinician, hope to see you March 26th for Let's Get Cranial. Thanks so much for joining me tonight, Sara.
Thank you so much for having me, Melissa. Good night, everybody.
Good night.